Hello and welcome. This is Dr. Carlo Oger, board certified emergency physician for PatientEducation.Video. In this video, we're going to be showing you how to change a G-tube. So this balloon is not inflated right now?
No, you can just pull it out. There's nothing there on it. I'm surprised it stayed in. But I do think some of her seizure medicine was leaked out. Oh, this is going to be interesting.
We can look.
Yeah, you can look at Nikki's replacement on the website. Does it look icky?
Yeah.
Oh.
And see, the balloon is actually torn right here.
Oh.
So this is why it malfunctioned. The balloon actually broke right there. And then it just deflates, and then something to hold it comes out.
What makes
So,
it
but that's
break?
it's wear and tear. Like I was saying, it's a
Okay.
a wheel of a car, or a balloon, or anything that's mechanical can break over time.
Yeah, we had one feeding tube that lasted, what, 2 years almost?
Really?
It got pretty icky, like, we go, we're gonna take that in, that's too long. But
So, for the procedure and for the teaching that we're doing, we always want to replace it with the same size, or maybe even a little bigger size. You never want to go smaller unless you don't have anything else, or unless it's a difficult insertion. So 20 French, 20 French,
Okay.
and you can see the colors change because of
Oh,
over
yeah.
time
Ew.
it just changes colors
Okay.
and stuff like that. This eventually moves
Did you
in.
give her formula this morning?
A little bit.
Oh, that's what that is then, isn't it? That's formula?
So this little thing here moves around, and the reason that moves, once we inflate this,
Yeah.
we pull back
Mm-hmm.
like that, and that creates a seal. Alright? When it's brand new, it has this little holes on it, and then they use this to put sutures through it and hold it to the skin until it's matured enough. I always go ahead and lock this up so you don't get like gastric juices coming through the tube while you're doing the procedure. And then this is where we go in to put the saline so that the balloon inflates. Kind of like a Foley catheter, you always want to test it to make sure there's no leakage before you go in. So you put some saline in and make sure that everything's mechanically correct with the tube. And that's nice and hard. And we take all that saline out. So that's the big water balloon that's going to be in there once we introduce it. And then it's simple. You just put some steady pressure till you're in. And you push it as far as you want. The stomach is big. So there's plenty of space for things to move around. It's not like we're going to go through and through the stomach or whatever.
Yeah, that was.
And we go ahead and inflate the balloon all the way in.
Okay, Nikki.
And we pull back. And that's where I meet the resistance.
Okay.
And now we pull this in.
That hole
to this.
doesn't get too large after.
And now it doesn't move.
Okay.
It's in place. Now we're gonna have the X-ray people come in and decide the gastrographing. All right. So this is just fluid with gastrographing. It's a radiodense material for when we do the X-ray. And one thing we should do is aspirate. There's gastric contents coming through the tube, and then we go ahead and push. And then when we do the X-ray, it's just going to show that.
Maybe keep that one.
You may.
The water's moving. Or skinnier like that.
We got to wash it or something.
Oh, that's all right.
And that's it. The tube is replaced now. There's no special gauzes or anything like that. We just put things to absorb whatever's around it. And so whatever normal care you used to do, that's still the same. It doesn't change.
Doctor, is there any pain with a feeling tube ever
There shouldn't be.
associated with it? No.
After the tube replacement, the X-ray will be performed to confirm that the gastrographene, the material, is within the contents of the stomach and bowel. Thank you for watching this video. Follow me on DrER.TV.